Winnipeg. 50 new cases of the virus have been identified since 9:30 a.m. today, bringing our total lab confirmed cases to 32,793. We're announcing a further 18 confirmed cases of B117 COVID variant of concern that have been detected, one of which is from Interlake Eastern Health Region, 17 are from the Winnipeg Health Region. And so case investigations are continuing, and this brings our total number of variant of concern cases that are confirmed to 41. We continue to see very few cases related to domestic travel, and this is, obviously a good thing. I think Manitobans are avoiding travel for the most part. I want to thank Manitobans for doing their part on that. I know that this time of year, there's a lot of plans that usually occur for spring break, as well as Easter and Passover plans. But we're going to continue to advise against non-essential travel. We still have the self-isolation requirements for those that do travel for non-essential purposes. We need to certainly celebrate differently this year. Can still do so through the household bubble or the designated visitors. But we do need to avoid travel over this time. You can remember in our first wave, a lot of our success related to the timing of that, our spring break. Because it was later on and we had restrictions in place, we did not have a large amount of influx of travelers all at once, which other regions saw and had very high case numbers as a result. So we're still going to avoid non-essential travel, but again, this isn't forever. We're going to stick to the fundamentals: hand washing, staying home when sick, physical distancing, wearing a mask in public places. And so this is critical if we, as we start to gradually loosen these restrictions. We need to ensure all other public health measures are strengthened. We are seeing the test positivity creep up. We're now seeing increasing variants of concern, which are much more infectious. So we need to be quite cautious moving forward, especially with our reopening plans. And so just in that regard, remember with the restrictions, it's always been a balance. We're never going to be in a zero risk situation. So just because things are allowed to operate within the public health restrictions doesn't mean that's a zero risk to go there. And so as we loosen our public health restrictions in one regard, we need to strengthen them in another. And this is the case and contact investigation. So people who are at a restaurant and potentially exposed to especially a variant of concern, well, they're going to be identified as contacts, and they and their household are going to have to self-isolate for at least 14 days. It's the same thing with the gyms and youth sports. If there is a case identified within that area, and it's very likely that those people will be named as contacts, and they, along with their households, will need to self-isolate for 14 days. So this is why the fundamentals are important. It's important to realize that we are seeing increasing transmission. So the chances of being named a contact increases the more you interact with others. But we can compare our numbers now to what we saw in November and December. We can see that Manitobans' actions have made a significant difference. But we are at risk of seeing that increased transmission again as we loosen things up, as we see more and more interaction. So need everyone to continue to follow those fundamentals. Do self-isolate appropriately if advised to by public health. We have to keep these numbers down at the same time as we're increasing that access to vaccines. And so I do feel, overall, we're in an optimistic place. but we still have to be quite cautious right now for these next many weeks as the vaccine rolls out. So thanks again to everyone, and happy to take some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Brandon Sun, Tyler.
Hello, Dr. Roussin. Thanks for taking my question. Mine's about the vaccine rollout. I was curious about an update on how the Keystone Center supersite is doing. I've heard of a few closures. I was wondering if that problem, whatever problem caused that, has been resolved, and whether any more vaccine sites are set to come up in Westman in the near future.
Yeah. So thanks for that. I think the vaccine rollout is overall going quite well. We're over 100,000 doses administered now. We're expanding our age criteria. So I don't have the details, about the Keystone Center and anything that transpired there, but I do know Vaccine Task Force has a lot of work being done with very difficult logistical challenges. So I do feel that that's back up and running. We can get more details on the Vaccine Task Force, and I don't have an answer necessarily for the any more sites that are planned there. I think the Vaccine Task Force will be out later this week, and they can answer some details on that.
Okay, and these variants of concern. You'd mentioned 17 in Winnipeg, one in the Interlake today. I was wondering, is there now community spread? Also, have there been any cases of variants of concern in Prairie Mountain Health thus far?
Yes, I'm not aware of any variants of concern that have been confirmed in Prairie Mountain Health. We have, of these 41, we have 9 that we can't link to either travel or other cases. So again, this is getting concerning to that more and more community spread. So we, like I say, we have to be very cautious. The more we interact, the more likely we're going to be exposed to these viruses. So fundamentals moving forward, we see that when these variants of concerns take a foothold in the transmission, when they become the predominant strain, we see those numbers in those jurisdictions climb rapidly. So we have to be very cautious for these next many weeks.
From the Winnipeg Sun, Glenn.
Glenn Dawkins from the Winnipeg Sun. Good morning, Dr. Roussin. First question I had is with the number of variant of concern cases that you announced today, is there worry that this may be getting out of control? We had, from our previous numbers, these are quite significantly raised. And if I understood you correctly, are we looking at mostly travel, or how are we looking at these new cases of the variant of concern?
Yeah, so for the variants of concern, most of them are related to contacts of cases. So I believe 8 of them are related to travel, 9 we don't have a link to, the rest are close contacts. So yeah, it's certainly a concern. We know this is much more infectious. And like I was saying, in other jurisdictions, when you see this become a significant proportion of the cases, we see case numbers climbing over time. So, I think we are really getting aggressive with our case and contact investigation. We are going to be treating most cases as if they were variants of concern until proven otherwise, because we really want to do what we can to limit the transmission while at the same time trying to loosen other public health measures, the restrictions that have been in place for so long now. So it's a challenge finding that balance, but overall we need to be very cautious with our approach moving forward.
Just kind of shifting gears here. On yesterday, there was a rally held downtown to do with Bill 35, to do with the hydro. Yes, a lot of the participants were wearing masks, but is there any potential for fines, or are you concerned in any way about such rallies taking place?
I think it's just the nature of an exposure. So I think we have outdoor group sizes, and so I think that when people are getting together, they should certainly respect the orders that are in place, limit contacts with those outside their household, wear masks when appropriate. So there'll be an enforcement update tomorrow, which may have more information on that.
From CBC Manitoba, Jill.
Good afternoon, Dr. Roussin. A local ICU doctor is concerned that loosening restrictions at this time could bring on a third wave by May, and with it possibly another lockdown. He says cases are going up, an increase in variants. What do you say to those concerns?
Well, I mean, I think we've all along been concerned about our numbers, right? And that's why we've had restrictions in place. I think that, obviously COVID is not the only issue related to people's health. And so we can't only focus on that. We know these restrictions have significant impacts on health as well. So we have to try to find that balance. And so we know we can't have high level restrictions on forever. Our Public Health Act requires that we use the least restrictive means to achieve the goals we're searching for. And so we're definitely concerned about our numbers. We're watching them very closely, but we can't focus only on those numbers. We have to find a way to balance and have a measured approach.
Can you provide any more information on the possible variant exposure on public transit? Was that case travel related? Is this a sign of community spread? What more can you provide on this? How concerning is this?
Well, I mean, the variants of concern are, in and of themselves are concerning. And so this is going to lead to, many more of these public notifications. Because that's unlikely we're going to be able to track down, all the people that may have been exposed. So I don't have the details on that specific case. We don't usually give details on a specific case. Obviously we want to share that was a variant of concern just because that raises the level of risk. But I don't have any other details about that individual to share.
From the Canadian Press, Kelly.
Hello. So the European Medicines Agency said several countries in Europe have either temporarily paused the use of certain batches of AstraZeneca or the use of AstraZeneca's vaccine altogether due to blood clots. So what are your thoughts on this vaccine, its safety, and its use in Manitoba? And can you say if it has been administered in this province or when it was planned to be?
Yes, it's already being administered in this province. That the AstraZeneca vaccine, we've been administering that, and just like any vaccine we administer, we follow it closely. I don't have any safety concerns with what we are administering in Canada. We don't have the same lots that have been raised concern in the European area, but even looking at that data, it's very limited to support any concerning findings. So in my opinion, this is a safe vaccine, and I'm going to be receiving this vaccine.
Follow up on that. Do you know when you have an appointment to receive that vaccine?
Yes, it is. I don't know the time necessarily, but it is this Friday, I believe, that I'm going to receive a vaccine, and it'll be the AstraZeneca vaccine.
From CTV Winnipeg, Danton.
Good afternoon. This is Danton Unger, CTV News Winnipeg. Dr. Roussin, I'm wondering if you can tell us if any deaths or hospitalizations have been due to the variant of concern that we're seeing here in Manitoba.
I'm not aware of any of those. These, the majority, we have 41 total, and remember, a lot of these were due to a retrospective screen. I believe we have 19 of them are currently considered active. I'm not aware of any deaths or hospitalizations related to them.
Okay, thanks for that. Then I guess we're seeing more variants of concern here in Manitoba. We've seen quite a spike today. Given that fact, I'm wondering if you can comment on this reduced mask use in churches, as that's an enclosed space for a long amount of time. Wouldn't that put people in those churches at greater risk of getting COVID-19, and now with the variant of concern more rampant in the province, at risk of the variant as well?
Yeah, and so some of this is the difference between an enforceable public health order versus public health advice. And so we know that right now capacity is very limited in these areas, often very large indoor areas. The masks are only going to be allowed to be removed when seated and distanced, only within the family unit. So in that regard, it significantly reduces the risk. Again, my advice is wear that mask whenever possible, even when it's not enforceable under the Public Health Act. We have people who are asymptomatic or mildly symptomatic, and they could be in these areas. That's the importance of the capacity limitation. That's the importance of the distancing. That's the importance of wearing it when people are singing, when increased transmission may take place. But overall, in that limited aspect, I don't think it adds a lot of risk.
From CityNews, Jonas.
Good afternoon, Dr. Roussin. Just kind of want to touch on the thought as we move through the spring here with vaccines rolling out and the balancing act you guys are going to pull with new cases, variants of concern versus vaccinations, and the hopefully protection against severe outcomes. Maybe just a thought on what's going to happen this spring.
Yeah, and so I think that you're right. It's always going to be that balance, and we're going to balance the need to have restrictions in place to limit the interactions in Manitoba and thus limit the amount of transmission that occurs. We're going to balance that with the proportion of Manitobans, especially the high-risk Manitobans that are vaccinated. Meaning that that should translate into less and less proportion of cases that require hospitalization. And then balance that again with what is hoped the seasonality of this virus, that moving forward, that like last year we saw improvements in spring and summer. So it's tough to predict, but those are all those type of things that will come into play, and the variants of concern just add complexity into that because they are much more infectious.
Thanks, sir. Just to follow up on that, so is it possible we could see maybe counts a little higher, but more of a focus on hospital and ICU admissions driving things as opposed to case counts like we saw in the fall?
Yeah, and so remember the what's really driving the restrictions is that morbidity and mortality, right? The severe outcomes and deaths. When we're in a stable wave, like in the November and December, the total case numbers are a good proxy to that, because we know 6 to 8% of those people would get admitted to hospital, 1 to 2% would go to ICU. But the vaccine will change those proportions, or we're expecting it to change those proportions. So that does mean that perhaps we'll be able to tolerate more total case numbers, because if people aren't having severe outcomes, then it's less of a concern. So it's just something that we'll have to watch really closely with our epi. We have far too few Manitobans protected at this point to see that play out right now. But the plans are, in the upcoming weeks, we're going to see more and more of that effect.
From CHVN, Taylor.
Hi, good afternoon. You touched on it earlier, but just what can people expect Easter to look like this year?
Yeah, so I think that the issue here is what we've been mentioning is the more people gather, the more transmission we're going to see. Although it's a time of year where people tend to travel and to gather, it's going to need to look different this year. So we do have opportunities. We still have those household bubbles. We still have the designated 2 for other people. So there's that opportunity to get together, but in that limited way. There's opportunity for outdoor gatherings, which are much less, risky for transmission. So I think I'd encourage Manitobans to look for, alternate ways to celebrate, to do so within those bubbles, to do so outdoors, to do so virtually, because we're just, we're really in that race to get Manitobans vaccinated. But it's going to really impair our ability to vaccinate Manitobans if we start seeing high test positivity rates again.
And on Friday, it was announced that singing and wind instruments in schools were a go again. Can you just share why this is now being okayed and what parents and educators need to know about this?
So I think it's again over time. We've seen our case numbers come down, certainly from where we were in November and December, and there's always that balance between the benefit of an activity, and the risk of it. And so we know our education partners have done a tremendous job right now at reducing the risk of transmission, in those settings. And so this is here where that balance now falls on getting back to this. But it goes again along to that message that everyone should take part in these activities in an informed manner. That if we were in a band class with instruments singing, and there was a case that was detected there, it's very likely that all those people and their families are going to have to self-isolate for 14 days at least. And so it's a benefit, but it's not without risk. But I think everyone will need to make that balance for themselves.
From the Winnipeg Free Press, Katie.
Good afternoon, Dr. Roussin. You've talked about the balance that you're trying to strike with the public health restrictions, and you've also talked about some of the targets that you'll be looking at to figure out how they're working. Can you tell us specifically what are the other public health concerns that are at play here? What are you prioritizing beyond the concern of the virus spreading that is guiding the reopening plans?
Mm-hmm. Yeah, and so I think that there's just a number of factors to consider, and the biggest one is that, like I mentioned, that morbidity and mortality, the severe outcomes, admission to hospital, admission to ICU, and of course deaths. And so we've the evidence is strongly suggesting that the vaccine is going to shift that. It's going to shift the amount of people that require hospitalization. It's going to alter the amount of people who are going to need ICU admission and decrease our case fatality rate as we protect more and more of the most vulnerable Manitobans. So this is what we're going to have to follow over time. But like I mentioned, it's we're weeks and weeks away from having a significant proportion of our most vulnerable Manitobans protected. And then again, it takes a couple weeks for that protection to take effect. So we have to be very cautious as we move forward, because if we start seeing high test positivity rates, it really makes it challenging to have mass vaccination clinics.
Okay, I have another question about the vaccine rollout. I don't know if you can tell us more about, we know that the province is planning to ramp up the daily doses, but that's not until next week. Meanwhile, we have still, thousands of doses in storage in freezers. And so why are we going to wait to ramp up the vaccine rollout?
Oh yeah, so this you have to address this from a programmatic level. So we receive doses, say on Friday, and receive 10,000 doses or so. So of course on Friday we're going to have 10,000 doses in our freezer. We have appointments booked for the week and the week after, and we don't know the exact date that the next shipment is coming. So we can't administer 10,000 doses on Friday and have zero in the fridge, not knowing whether we could honor our appointments for the next week. So of course, we get that shipment in. That shipment's going to be provided to Manitobans through that next week because we have appointments made. So we can't just empty our freezers the day we receive them because we have appointments booked for weeks. So it's a programmatic view of this. We don't know the exact date that different shipments come in, and so this is how you run a program. And so we're not keeping doses in the freezer. They are constantly in motion. But of course, on the day you receive a large shipment, you're going to have a large amount in the freezer, but you're going to work through those that week.
Our final reporter this afternoon from Global News, Joe.
Hey, good afternoon, Dr. Roussin. Of the new 18 new variant cases announced today, are these cases all recovered and they were found while you were going back through old cases, or are these new cases active now?
Yeah, so on these particular 18, I don't have the exact breakdown on that. I know that we have 41 total confirmed, and 19 of those 41 are currently considered active. So some proportion of these 18 are still retrospective, some of them are active, but overall, of the 41 total, 19 are currently active.
Gotcha, okay. And in BC, it looks like they're cutting off liquor sales early for St. Patrick's Day. Is anything like that being considered here?
We don't have any immediate plans to further restrict our public health orders. We already have, time restrictions on, say, restaurants and licensed premises. And so we will follow our same process for the most part on the restrictions.
Thanks, everyone. This concludes our media briefing.
Thanks, everyone.